Greetings and salutations. Thank you for lending an ear to The Voice of the Times this Monday, December 14, 2020. For today's editorial, AstraZeneca's dropping of Philippine vaccine trials is more relief than setback. It is probably salutary and not disappointing that Swedish-British drug manufacturer AstraZeneca has withdrawn its application to hold clinical trials for its COVID vaccine in the Philippines. The drug maker has decided to hold the clinical trials instead in another country, Russia, the Food and Drug Administration, or FDA, said. In turn, the Philippines will now be free from its earlier decision to sign a commitment to purchase agreement with AstraZeneca, even though it still has to complete its clinical trials and prove its vaccine's efficacy and safety. The deal would have involved 2.6 million doses of the AZ-1222 vaccine, which is envisioned to become available for use only in May and June 2021. The decision to drop the Philippine trial came after AstraZeneca decided to accept a proposal from Russia's Gamaleya Research Institute that it conduct the clinical trials of its AZD1222 vaccine alongside Russia's Sputnik V vaccine to study its efficacy, since both vaccines use adenovirus vectors that contain the genetic material of the SARS-CoV-2 virus spike protein. The AZD1222 vaccine, which the Swedish-British manufacturer developed jointly with the University of Oxford, will now be used alongside Sputnik V in clinical trials before the end of the year. The financial backer of the Gamaleya Sputnik V vaccine, the Russian Direct Investment Fund, or RDIF, offered AstraZeneca the use of one of the two components of the Sputnik vaccine. While both vaccines use adenovirus vectors that contain the genetic material of the SARS-CoV-2 virus spike protein, they differ in the source of the vector. AZD1222 used the adenovirus of the chimpanzee, while Sputnik used human adenovirus vectors found in the common cold. According to the RDIF, the use of two different adenovirus vectors for a prime and boost immunization would be a unique and groundbreaking discovery, as this could raise efficacy and create long-term resistance to the virus. Scientific collaboration with Gamaleya Research Institute is important to explore the potential of vaccine combinations, unlocking synergies in protection and accessibility through a portfolio approach, the Swedish-British drug maker said in a statement. FDA Director General Rolando Enrique Domingo told the Manila Times that AstraZeneca had gathered enough data that convinced it to withdraw its application for clinical trials in the country. It is not necessarily a setback for the country to lose a chance to hold clinical trials for a COVID vaccine. A clinical trial means some members of our citizenry of different ages would serve as guinea pigs for the AstraZeneca vaccine. Clinical trials carry risks for participants. In Brazil, there is a confirmed report of one death in the Phase 3 clinical trial for the Chinese Sinovac vaccine. The Pfizer-BioNTech vaccine, which is the acknowledged leader of the pack today because it has begun limited distribution and inoculation in America and England, has also met some setbacks. There was a report of 6 deaths during some of its clinical trials. It is unpleasant to contemplate the thought of a Filipino participant dying during clinical trials of a COVID vaccine. Public reaction to such a tragedy could be tricky or unpredictable. There is understandable cynicism among Filipinos about drugs on trial because of our unhappy and costly experience with the Dengvaxia vaccine for dengue fever. As many will recall, the Philippines, led by Vaccine Czar, Secretary Carlito Galvez Jr., and a donor group from the private sector, signed a deal with AstraZeneca for the Philippines to purchase 2.6 million doses of the vaccine, which will become available between May and June 2021. This is all very iffy. The AstraZeneca vaccine is still conducting more trials. The only positive note is that in earlier trials, the vaccine was found to have a 70% effectivity rate. The rating may or may not improve in the coming trials in Russia. Meanwhile, it makes more sense to feel a sense of relief from the advanced commitment to and from AstraZeneca. The Vaccine Expert Panel and Ethics Review Board, which approved the purchase of AstraZeneca in advance, will have nothing to account for if the vaccine flops. If the vaccine surprises by becoming a spectacular success, we can line up and purchase our share of it. And that's the editorial for Monday, December 14, 2020. For more news and information, get a copy of the Manila Times on print, subscribe to our digital edition, or log on to www.manilatimes.net. Follow us on Twitter, Facebook, and Instagram, and listen to the Voice of the Times.